So this is the probe. The probe has different markers on it. Notice that there's a little elevation here and there's an elevation on the side. These markers are used to help you to orient to the patient. So if you look at these and you look at the screen, on the screen there's a little blue box with an S, and these will correlate with that. So if I like to keep mine turned to the left, that way when I'm holding this, if I'm going to move my needle and I move it to the left, it's going to be towards that orientation marker, and then it'll show up on the screen moving to the left, and that helps me to see which direction I need to move on the screen. Also, there's a little arrow here. Now that arrow needs to be centered. So when you do put your probe onto the vessel, you want the vessel on the monitor to be on the center of the screen. So that's what that little arrow is for. As long as you keep that centered on the screen, then you know you can aim your needle towards that arrow and you'll find the blood vessel right away. Another thing with this probe is notice that the top of it is flat. We call that linear. That's a special type of probe. In ultrasound, there are various types of probes. There are square ones, and there are long ones, and there are rounded ones. We want just a basic flat one, about this length, enough to cover a vessel. And the further away it is, the wider it gets, but we want just enough to be able to cover a vessel. Now, an important part of using a probe is to remember to clean it regularly, and what this means is before and after each use. When you clean it, use manufacturer-approved wipes. Because if you use the wrong wipes, you can actually damage the probe and it will void the warranty. So when you clean it, make sure that you get the little grooves wherever these little things, these little pieces are. If you have a needle guard, there'll be another one right here, and that's more area where bacteria and germs can reside. So you want to make sure to clean carefully around those small little grooves and areas. Another thing to remember is the cord. This cord generally lays across the patient, so make sure that you clean the entire length of the cord. And we're going to do this before and after use each time. The reason for that is sometimes we get busy and we think we cleaned it and we didn't. We want to make sure that it's absolutely clean before it goes anywhere near a patient. Now, the Infusion Nursing Society says that you should use a probe cover. In order for the ultrasound to work, you need gel to allow the ultrasound to access the tissues without any air interference. Now, there are two different types of gel. You'll see that we have gel in a bottle and we have gel in a little packet here. We do not want to use the gel in the bottle. The gel in the packet is sterile. It's for individual use. Studies have shown that the gel in the bottle can carry bacteria that will grow and contaminate from patient to patient. So do not use the bottle, just the packets. And most of these probe covers will come with a packet of the gel. It'll come with 2 rubber bands and then the probe cover itself. And the nice thing about this is that you can use this as your field to lay your supplies on. Always put gel beneath the probe cover and then again on top. Now, there are different probe covers. This one, you basically just open it up. I like to put a little extra gel on the inside. And then you just slip your probe in. And pull this straight down to the end. Then it's got the rubber bands, and the idea with the rubber bands is to keep a tight contact here so that you don't get a lot of air in the way when using the ultrasound. You can use one or you can use two based on your preference. And then before you use it on the skin, you'll put more ultrasound gel on the top of this. Before I do that though, I want to show you the difference between the views. So this ultrasound, where that little gray patch is, you'll see that's the window that looks at the vessels. Think of it as a flashlight. All the light that comes out of that square or that rectangle will shine on the vessel, and that's what you'll see. So if the flashlight is shining like this, you'll see this much of the vessel. If it's shining like this, if you do it sideways, you'll only see that much of the vessel. So this would be the longitudinal view, and this would be the short axis, which is just a smaller piece. So why do we want to see a short axis? Well, let me take this needle. When you're inserting the needle into the vessel in the short axis view, you're going to actually see the needle as it enters into the vessel. This will allow you to very carefully guide that needle directly into the center without causing any damage. As you insert this needle, the view that you're looking at with the ultrasound should be moved so that the needle tip is always in the center of the view. That way, as you advance the catheter, you can see that it's going in the right direction and not going through a blood vessel. When you insert the catheter in the longitudinal view, what you're going to see is the length of the needle inside the vessel. Now the problem with this is nice because it allows you to see the whole needle at once inside the vessel and not just the tip. The problem with this is if the needle is just on top or just beneath the vessel, it can be mistaken as being inside the vessel. So it can be a little trickier. The depth is a little bit more difficult to view with this vessel. So that's why we recommend the short axis view, because then you'll be able to see the needle as it enters into the vessel each time and make sure that it's dead center where it needs to be. Before using a needle on a patient, we want to clean the area properly. You can use alcohol wipes, you can use betadine, which are in some of these IV kits, or chlorhexidine. All three of them will kill the bacteria and viruses on the surface of the skin. We like chlorhexidine because it will kill the bacteria for up to 48 hours, whereas these generally work for a shorter period of time. The problem with the providine iodine is that people with allergies wouldn't be able to use this, so you need to make sure that you check for allergies. The problem with alcohol is that if you're in too much of a hurry, it will sting, and that's an unhappy situation. The other thing to consider is that you have to allow proper time for these to dry, because it's during the evaporation process that the cells are lysed and actually destroyed. If you blow on it, fan on it, or try to insert the needle while it's still wet, it wouldn't have a chance to evaporate, and therefore the harmful cells will still be there and you could be infecting the patient. So be careful of that. When wiping, we want to scrub up and down, side to side. Normally we want to do this for 2 minutes on a patient before we access them. For the sake of this video, I'm not going to do that, but you're going to just make sure that you rub it from different angles. Because of the hair follicles, we want to make sure that we get completely around the base of each hair follicle. Then I'll allow it to air dry. And since this is a mannequin, it may take a little longer, so we're just going to pretend. I like to put my gel on the ultrasound probe. Now notice when I hold this probe, first of all, this cord can get in the way, Make sure that you arrange it so that it's not putting undue weight on your hand, because your hand has to hold up this probe. Also notice that I'm making this C with my hand. The C shape is to hold it properly. And I have a pinky that I'm going to use as a kickstand. When I put that pinky down, it gives me the leverage to be able to move this without having it be unsteady. As I use this, I want to be aware that it's at a 90-degree angle. Notice that if I lift up one edge, you'll see the lines there. That's because there's air interference. Whenever air gets in the way, it causes artifact, and then we don't see it clearly. So I want this to be at a 90 degrees with the skin so that I can have a nice clear image. Now notice that in the ultrasound image, the vein, which is a circle, is on the very center of the screen. That's because I'm moving the probe until I get it right where I want it to go. Because it's centered on the screen, I know that the vein is right where the arrow is on the tip of my probe, so that's where I can put my needle. I also have been aware of the orientation markers. So I'm feeling now, and I actually have it backwards. My orientation marker is on the left for me, so that it's on the left on the screen. And this allows me to know that if I put my needle to the left on the mannequin, it's going to go to the left on the screen. And so I can adjust it that way. Before we start using needles, I do want to discuss a little bit about depth. So usually when we insert a needle for an IV, we go at a very shallow angle. And that's because generally the vessels are at the surface of the skin, so we don't need to go very deep. And that's the ones that we can see and feel are generally close to the surface. But when you use an ultrasound, you're actually looking for vessels that are deeper than your typical vessels. And because of that, if you use a very shallow angle, you'll run out of needle before you get to that vessel. That's why for these, we would increase our angle and enter it like this. And then once we go in, drop our angle and advance it. But notice that the deeper it is, even with an increased angle, you're going to need a longer needle. So you may have to adjust your needle length depending on how deep these vessels are. All right, so here is my mannequin. And we are going to access a vein. Now notice on the screen that the vein is round, looks like a black hole pretty much. When I push down on it with my probe, it squeezes shut and it stays squeezed shut. Now an artery would look like this when I push down on it. It wouldn't squeeze shut and it would pulsate. But since this is a vein, it won't do that. It will just stay flat. So I'll stay centered, take my needle, and I'll insert it where the arrow is. And you can see right on the screen my needle as it enters the vessel. Now what you're seeing on the screen is this. You're seeing my needle entering the vessel, and this is the needle inside the vessel. You can see the tip of the needle right inside the vessel. Notice that as I advance the catheter, I have to advance the vessel and advance the catheter and then advance the vessel. If you don't move that, then it won't stay where it needs to be. Now I walked mine all the way in. Notice it went all the way up to the hub. And this is especially helpful if you have vessels that are tortuous or have a lot of valves and they're very hard to access. If you just keep moving the probe, keep moving the needle, keep moving the probe, keep moving the needle, you can actually walk this all the way in and not have to thread that catheter at all. Just have to remove the needle when you're done. Now, when I'm in there's two things I need to be aware of with the needle. First of all, I want a needle that's not going to take up more than half the inside of the vessel. The reason for that is blood needs to flow around that catheter. If blood doesn't freely flow, it stays stagnant. Blood that's stagnant clots, and then you have little clots there that will cause the catheter to clog and not work properly. So if you use too large of a needle, it's not to the patient's benefit. I know that as nurses, we are always taught use the largest needle possible to allow better flow. But if that flow does not allow flow around the needle, then it will still clot, so it won't do you any good. The other thing to be aware of is the how much of the catheter is going to be in the vessel. So in this case, we have half of the catheter in the vessel, and that's acceptable. If my angle was too high or was too low, and I wasn't able to reach it so that half of the catheter was in the vessel, then as soon as that patient moves, it's going to be very easy for that catheter to slip right out. So we need at least half of that catheter inside of the vessel in order to keep it in place and avoid it from being from coming out. Okay. So when I'm in the vessel, okay, so this is a short axis view. I'm going to turn it to the side and give you a long axis view, and you'll be able to see the needle inside of the vessel. The nice thing about the long axis view is that you don't have to move the probe with the needle. However, again, because it's a little harder to see, it makes it easier to make mistakes. So when I've confirmed that I'm in, here's my needle right in the dead center of my vessel. I've confirmed that I'm in. I'm going to pull this out, and I'll get blood return if I'm in. And notice I didn't get blood return here. So I want to check to see, am I really in the vessel? Well, the problem is I took the needle out, so I'm not able to see anymore with the ultrasound, but I can see movement with the ultrasound. So if I connect my saline here, and I put my ultrasound back on, right about where I think the tip would be, and I flush, you can see on the ultrasound the bubbles from the saline flushing. And that helps me to see that, yes, indeed, I am in the right place. If you push the flush and you don't see that happening, then your needle's not in the right place. This is a great way to check when coming to troubleshoot and the needle is no longer in the patient. You can use this to see, is the needle where it belongs?